Hello, everyone, and welcome Dr. Luis. Dr. Luis Renato is from the Abu Dhabi Equine and Camel Hospital, and today we're going to talk about EIPH in our Equine Health Report. Welcome, Dr. Luis.
Hello.
Hi.
Hello, how are you? How is everyone?
Alhamdulillah. How are you doing? How was your weekend?
It's this weekend, thank God it was not so busy, but I am afraid to say that because probably next week it's going to be a nightmare. So,
yeah, it's called
but
jinxie.
It's okay. It's fine.
All right.
Exactly.
So the big question is, what is EIPH?
Being very straight, EIPH, it's a bleeding coming from the small vessels inside of the lungs, and it's caused by the activity, by exercise, and it's called. There is a lot of concerns about what it's the primary cause of the pulmonary hemorrhage, but in concept, it's bleeding coming from the rupture of the small vessels in the respiratory units inside of the lungs.
Right. And what are the causes?
Yeah, the main cause for the bleeding, it's the increase of the blood pressure during the hard exercise. But the cause of this rupture, it's unclear until now. Some authors or some researchers, they are saying that it's caused because of the increase of the viscosity of the blood inside of the vessels. Other authors, they are saying that it can be caused by a mechanical stress caused by the lung in contact with the lumbar and thoracic spine during the gallop, and the movement of the chest and the diaphragm, and can cause some compressions, because we are seeing from a long time that the bleeding is coming most of the time in the dorsal and caudal areas of the lung. So it's exactly in this area between the ventral part of the vertebrae and the movement of the diaphragm. So there is a lot of ideas of why these vessels are rupturing inside of the lungs, but it's caused by the increase of the blood pressure during the exercise.
Right. Makes perfect sense. And now in the Middle East, we see a lot of types of horses, lots of breeds like thoroughbreds, Arabians, and even warm bloods are here. Now, research shows that EIPH affects virtually all performance horses. Is there some particular type of horse or type of breed of horse that is particularly susceptible or resilient towards EIPH, or everybody is equal?
No, it's every kind of breed. It's susceptible to the pulmonary hemorrhage. What it's gonna make more common or more frequently the episodes of hemorrhage in the horses, it's gonna be the type of the exercise that these horses are doing.
Right.
And the healthy of the lungs.
Right.
So if it's a sick lung, a small gallop can cause a bleeding coming from the lungs caused by the exercise. Right. So there is no predictable for any kind of breed. It will. Right. It's gonna determine the appearance of the hemorrhage. It's gonna be the type of the exercise, the intensity of the exercise, and the health of the lungs.
But this is not the case with any other type of animal. So this is very unique in terms of a respiratory anatomy for the horses specifically.
No, No, humans are showing episodes of pulmonary hemorrhage too.
Oh,
Humans,
really?
dogs, yes, humans, dogs. It's not a simple, it's not specifically from horses, this
Right.
kind of
Okay.
symptoms, or because nowadays there is another concept. They are some authors, they are considering right now the pulmonary hemorrhage not as a disease, but a physiological alteration caused by the exercise.
Right.
Yeah. Nowadays, they are some authors, they are saying that it's not a disease anymore because 100% of the horses doing some kind of exercise, they are experiencing pulmonary hemorrhage once
Right.
in their lifetime.
Oh, wow.
So yeah, so that's why it's considered right now a physiological alteration and not a disease anymore.
Wow. So it's a
But
change in the way
but
it's being looked
even
at.
being a physiological alteration,
Mm-hmm.
it's causing a lot of loss of money. It's the most important economic loss of money in flat race
Mm-hmm.
horses, for example.
Mm-hmm.
Because as much as we are keeping the horses without training because of the bleeding,
Mm-hmm.
it's money that we are spending without anything back.
Absolutely. Absolutely. Totally agree with you. And
Yeah.
how, with the Middle East having some of the richest races in the world, like Dubai World Cup or the Saudi Cup, and we also have the EIPH, but we also have challenging climate conditions, like it's very hot and arid here in the Middle East. So does it make the impact of EIPH more severe or the management more difficult? Or is
Yes,
it
for
the
sure.
same everywhere in the world?
Yes, the weather it's a very important factor in
Mm-hmm.
the appearance of the bleeding in the lungs, right?
Mm-hmm.
But we have a misconcept around about the Middle East, mainly about Dubai, Abu Dhabi, these countries, because
Right.
the most important, the problem, it's more the pulmonary hemorrhage, it's more significant when we
Right.
have a hot
Mm-hmm.
temperature and high humidity.
Oh, I
And
see. Okay.
in Dubai and Abu Dhabi, actually, most of the time when the horses are in trainment or at the racetracks,
Uh-huh.
they are facing this problem. They are facing higher temperatures and high humidity
Yes.
because the change of the heat coming from the metabolism of the
Mm-hmm.
horse, it's difficult to change this heat with the environment, and
Right.
this can cause a lot of other problems, including the pulmonary hemorrhage.
Right. And
And here, sorry.
no, continue, continue. I will tag on at the end.
And even here in the Middle East, we have another problem. We have the sand, and the sand can cause small inflammations in the lungs or in the airway tract.
Mm-hmm.
And this inflammation can be a predisposing factor for pulmonary hemorrhage.
Right.
So yeah, but listen, even the most it's alteration or it's a sign caused by exercise that can affect the most important horse of the stable and in
Mm-hmm.
the very poor horses. And we need to understand a season is not made only of grade 1 races.
Right.
We have the small grade races to make the
Mm-hmm.
season reliable for the small owners and trainers.
Mm-hmm.
So it's a problem not even for the grade 1 horses, but for all the horses at the racetrack or in the training stage.
Mm-hmm. Now, are there any unique considerations for, when you're dealing with these kinds of temperatures? Do we have anything that we can do to sort of, like training early morning? Will that reduce the pressure, circumstances for EIPH?
Of course, as much as we are avoiding the horses to be
Yeah.
exposed to these
Mm-hmm.
as it's not to these weather environment effects, it's better for them. We are going to keep the healthy of the lung as much as possible closer to the higher level of the respiratory condition. And of course, training the horse in the colder periods of the day, provide them a very cool environment during their rest time, a very clean environment without sand, dust, and all of these things to make the lung healthier. It's all important. But yes, we need to deal with these in hotter environments, in countries that we are facing these problems. We need to deal with it as better as possible.
Now, if we look on the other side, now we have horses that are trained here, but they travel to other parts of the world for competition. So they go to the Kentucky Derby, they go to the US, they go to the Royal Ascot in the UK. So how do you navigate these medical regulations, or do you navigate them?
First of all, we need to know the rules of each country that we are going. In my native country, for example, in Brazil, it's allowed to use furosemide for horses with 3 or more years of age. But nowadays in the world, based by the jurisdiction of the International Federation of Horse Racing Authority, the main concern from them right now, is to remove all the medications in all the countries that are under the jurisdiction of IFA. So there is a plan, and the plan is already in force to decrease the amount of use of, for example, furosemide for flat race horses all over the world. But the most important is to know the rules of each country. So when you know what you are facing and what is the rules, it's better for your management during the week before or the 2 weeks before the most important races in the world. We know it, for example, in UK or in Europe, most of the countries, they didn't allow any kind of medications. Even here in UAE, it's not allowed. So, but we need to deal with these situations. We need to know very well the horse, the peculiarities of the horses. We need to know what these horses like to do during the training, for example. And the trainer that it's more the job of the trainer than us vets. The trainer that he must have this feeling to deal with the situations, the regulations of each country. We can decrease a little bit the type of the exercise. We can use more vitamins, or we can use some nebulization. There is a lot of ways to deal with these problems in countries that it's not allowed to use any kind of medication.
And what would be sort of alternative, what would be an alternative management strategy for this? So would it be, like you said, supplements? Are there any other alternative management that can be used, or is it?
It's hard. It's hard. Difficult? There is some, yes, because we don't have a specific medicine or treatment to avoid this condition. Even the furosemide, we are not using to avoid the bleeding. We are using to decrease the amount of bleeding produced by this hemorrhage. So, it's not a therapeutic treatment. It's a prophylactic treatment, as we said. So we are using to try, if it's a horse with a grade 4 without any kind of medicines of bleeding, we are using the furosemide to decrease this blood to a grade 1 or 2. There is a lot of concerns about this drug because in some countries or some people, they are saying, no, but why the horse needs this drug to run? Actually, the furosemide, it's proven already that it's not increasing the performance of the horse. It's allowing the horse to show his or its ability as a horse.
Mm.
Because the blood inside of the lungs, it's restricting his capacity.
Yes.
So
Yes.
when we are using the furosemide, we are trying to make to allow the horse to run what they know.
Absolutely.
But there is a lot of other things involved. The use of other drugs that it's not going to show in the anti-doping exam because of the use of furosemide, and the reducing of the weight of the horse. Because after 2 hours of the injection of the furosemide, for example, the horse is losing about 2% of her body weight. In a 500 kg horse, they are going to lose around 20 kg of 12 to 20 kg. Right. If 500 grams, it's enough to disqualify a horse if it's when they are returning, if they are missing 500 grams, can you imagine a horse running with 10 kilos less? And yes, exactly.
Within 5 minutes,
This is the discussion of the drug, the furosemide, around the world.
Yeah.
But of course, it's a drug used intrinsically in a flat race horse to promote his performance. Yeah. So by definition of the doping situation, we cannot use. So it's a very controversial talk all over the world about furosemide mainly, but it's a nice talk.
It's a nice talk. What about things like nasal strips, omega-3 supplements, this modified training, those kinds of things, controlled water? I don't think you want to control water, but
we need. This is the beauty of the things, actually.
Yeah.
Nasal strips, for example, in my opinion, it's a waste of money.
Right.
Because it's proven in humans that it's not. You are not seeing any athlete using anymore these dilators to practice their type of exercise. So it's proven that it's not having any effect. There is only one paper saying that the nasal strip is helping horses by the bronchoalveolar lavage, but this paper was paid by the producer of the nasal strip.
I see. Yeah.
It's not paid, it's sponsored.
Yes.
So, and being more specifically, we are increasing the area of the nostril, but we need to remember anatomically the horse, the head of the horse, it's big. So we have 40, 45 centimeters of rigid structures that if we are increasing the intake of air, we are going to increase the negative pressure, and it's going to be worse for the problem, for the pulmonary hemorrhage, actually.
Right.
But they are using all over the world, and I think it's more by the feeling of the owners and trainers to see their horses using than not using. So, because honestly, clinically, I'm not seeing any significant effect of the use of the nasal strip.
Right.
Omega-3, it's always good for a lot of things, not only for pulmonary hemorrhage. We can use some nebulization with some medicines. There is some nutraceutical medicines that they are using nowadays. And but for me, the most important and the newest treatment that we are using, it's the use of PRP.
Sorry?
It's plasma-rich platelets.
Right, plasma-rich platelets. Okay.
Yeah. This is we are seeing a huge improvement of the horses. It's not curing the horses, but we are seeing an improvement very good when we are treating the horses with PRP for pulmonary hemorrhage.
Before or after the race?
Before, always before.
Right, and this is IV, given by IV.
It's done. No, we use it pulmonar. It's not intrapulmonary, it's intratracheal or intraalveolar, we used to say. We used to inject these substances with the use of the endoscope with a probe.
Right.
And the horses, and they are getting better.
Wow. And this is something that you are able to do before the horse actually races.
We need to do before.
Right.
Because after the race, they are going to bleed. Actually, we can do it. We are going to manage before and after, and after.
Yeah.
According what they are showing after the race, for example.
Right.
If they are bleeding grade 1, a very small amount of bleeding, as I told you, nowadays, a grade 1 hemorrhage, we almost consider it a normal findings during the exam. It's not the grade 1, but we cannot say that because I saw a lot of horses failing with grade 1, and I see a lot of horses winning races with grade 4 or grade 5.
Right.
So it will depend. There is a lot of things involved in these situations. There is the track condition, the weight of the jockey, the type of the race that they are running. Maybe they are running in a low grade quality that in this race they have a better chance to win. There is a lot of things involved in a flat race horse, in a flat race. But the use of PRP, we needed to deal with this. We needed to see the result of the endoscopy after the race, and we are gonna manage this horse according with how much they are bleeding and the necessity for the next races.
Right. Now, last question. Any other treatment or research that you are hopeful about? Something that you have read about, maybe you have not tried, but something new that you think is coming out? Or so far, PIP looks to be the...
PRP, it's the newest treatment. It's what we are doing right now and with good results.
Right.
They are doing some research about biomarkers, inflammatory biomarkers that can predict the fragility of the small vessels inside of the lungs. They are doing some researches about ultrasonography to see with the use of the ultrasound if the lung parenchyma is showing some alterations that can predispose the horses to suffer from pulmonary hemorrhage. But no, there is I'm not seeing too much new papers that can be promising for the next 10 years.
Fantastic. Well, thank you very much. You were very enlightening in terms of information about EIPH. And I really appreciate this. And I hope we can do this again with another topic.
Thank you so much. Thank you for the opportunity. And I'm more than happy to help when you
Thank you so much, sir. It was lovely talking to you.
Thank you.